You know what you're listening to, right? 3, 2, 1.
Uzima Health and Wellness.
What the doctor say? Welcome to the Uzima Health and Wellness podcast. I am your host, Dr. Kendra Outler. We are talking about the social, political determinants of health. We are talking about health disparity. We are giving you the questions that you need to be asking. Let's talk family.
Hi, I'm Tamara G, and welcome to What the Doctors Say podcast with our very own Dr. Kendra Outler, MD. She is an anesthesiologist based in the DMV. You may know her from her platform, myuzima.org. She's dedicated to addressing health disparity and also helping us understand health equity. And her frequent talks on BDO, that's blackdoctor.org, are amazing. You should see them if you haven't. Or you can always listen to her here at What the Doctors Say. Dr. K, how did you come up with that name?
You know, I get so tickled when I hear patients after I walk out of the room go, what the doctor say? And so it just stuck to me that, you know, sometimes they say listen or the doctor speaks, but, you know, you always have to ask yourself, what the doctor say? And I've had to ask my relative or ask my dad, what the doctor say, Dad? And so however you say it, you better say it. And so that people know that you're very interested in what the doctor say. That's right.
It. Well, we are interested in what the doctors say. And Dr. K, as a doctor, I am sure that you are, I don't even know what word to use. I would say reeling maybe from the Roe versus Wade reversal. I think it has hit this country finally that some things are, you know, falling apart from the top down. This is a pivotal moment in American history, American medical history. How do we not feel powerless in this? Because it just seems like the power has been taken out of our hands.
You know, Tamara, that's a very good question. I mean, I've been analyzing, how do we get here? I recently read this book by attorney Daniel Dawes called The Political Determinants of Health. It is helping me to connect the dots to how we as a nation can have such a setback. First, let me say that I've had the pleasure of meeting attorney Dawes, and he's the author of 2 books, 150 Years of Obamacare and The Political Determinants of Health. He is the executive director of the David Satcher Institute in Atlanta, and he is the leading expert on the conversation about racism in medicine. And he recently testified in Congress about the lasting effects of racism in healthcare. So, you know, his book, The Political Determinants of Health, is actually something that I've opened up and read recently so that I can understand how we can reverse such a landmark decision, how the Supreme Court can reverse that, something that has great implications on the health of women and men, to be honest with you, in the U.S.
So Attorney Dawes has written this book about the political determinants. Now, I've heard about social determinants like housing and education, but apparently there's also political determinants too to health.
Yeah, I mean, we always, always think about housing, geography, transportation, but the political determinants of health, what Attorney Dawes makes the point that we're too focused on the downstream determinants of health. For example, looking at only an individual, what did that person do to get monkeypox, let's just say. Mm-hmm. We're looking at the community levels, for example, COVID deaths on the Indian reservation, versus looking upstream, as what he calls it, at a broader levels to address structures, processes, and outputs that result in our inequities. His guide to understanding that one of the major exacerbating factors exacerbating the disparities in health is our political system.
And you know, that's I never thought about that. I mean, seriously, now that you're saying it out loud, it is absolutely our congressmen and senators and elected officials who most of them don't have a doctor's degree, mm-hmm. that are making determinants on what is good for our health and well-being, mm-hmm. when maybe they aren't the ones to do that.
Well, that's true. I think that, he does make the point that they are ultimately making our decisions. I mean, we do have to start at the advocacy level and go up. But again, when we think about how things become dismantled, we do need to start to think of that process that is what he describes as upstream. What is happening upstream? And then therefore we can kind of come up with a game plan on the community level or as an individual to push a certain agenda, support a certain agenda, because ultimately we have to know how our government works. And as we see now, our government can work to set us back.
Mm. And so there are conditions like, I know this is one of the ones that you are really into, maternal deaths and maternal morbidity, early infant deaths, gun violence, very important in our communities, opioid addiction, that's affecting everybody. I guess he's talking about those are also some political determinants that are having these conditions stay around.
Yeah, it's amazing that, as he writes this book so eloquently, describing, that there are conditions that have lent themselves to kind of being able to flourish, if you will, because of inaction of our politicians. And for instance, one of them is maternal morbidity, mortality. I mean, you have to understand that states can regulate how long a woman can be covered for her health care after having a baby. And what we know about science, the science behind when a woman may die or get sick, is we see most of these cases after the baby's born. So if you limit how long she can have insurance, or if she gets pregnant again, she has to go back and get insurance again. We're creating barriers to healthcare. One of the maybe the most relatable one is gun violence. We're seeing a surge. Sadly, we had another mass shooting yesterday, and we have to remember that all mass shootings are not getting the same attention. So we saw one yesterday, but trust and believe there was probably another one. But what he says in his book is that, the NRA, we always say NRA, but what is it about the NRA? And I didn't understand this until I read his book, that they have effectively lobbied and pushed lawmakers to terminate funding for gun violence research at the CDC. And that's the Centers for Disease Control. And I thought, okay, so they lobby a lot, right? So we have these lobbyists that do this for certain interest groups. And so they got this policy writer known as the Dickey Amendment. Imagine that a name, the Dickey Amendment, that was passed in 1996. And this effectively banned gun violence research and has created this whole absence of research involving the impact of firearms in a community. Communities like, Black communities in Chicago, communities that we're seeing now that are pretty much reeling from gun violence. Mm-hmm. And so, and I didn't know that as a physician, that would then limit my practice, my abilities, spoken or unspoken, to ask questions when I interview a patient about whether they are either being exposed to gun violence, whether there's a gun in the home. And you never really think about that until you read it in his book, that you're right. As an ER physician, and particularly one that took care of adults and children, that if I saw a gun shot victim, I didn't put down on the data sheet, gun was in the home. And so you'll think about, well, why is that important? It's important because you can correlate zip codes. Now we get back into the social determinants of health and how the social determinants of health and political determinants of health now both matter and both are very important. But this Dickey Act, which was lobbied by the NRA, is effectively why we don't have the necessary research to then bring to our policymakers and say, this is not good for us.
Mm-hmm. If you're just tuning in to What the Doctors Say, we have Dr. Kendra Outler. She's an anesthesiologist based in the DMV, Delaware, Maryland, Virginia area, DC, Maryland, Virginia area. And we certainly appreciate her giving her expertise today, talking about Attorney Daniel Dawes' new book, Political Determinants of Health. And we are just learning that everything is not a social determinant. There's political determinants as well. And it's a very academic book, seems very detailed. Will the layperson be able to understand it? Someone like me who doesn't really, know all the medical terms and the things that Attorney Dawes talks about.
I think this book is a must read. Of course, we have to think about the sophistication of the book, but the political determinants of health is broken down to three very relatable pieces. And what he's been able to do is bring together full circle the issues that we are confronting. But if there's nothing that you can take away from this book as a lay person, you should appreciate that we all know voting. We've heard that word before. That is the first determinant of political health. The first, determinant of political health, as he describes it, the vote or the act of voting. I mean, we are facing voter apathy. COVID just done beat us down. We think, well, why did we do all this marching, voting? The police violence has really just beat us down. We did have another shooting of an unarmed Black man with 60 bullets. I mean, you can imagine those communities feel like, what am I voting for? But voting is your political power. And it's your right to do so. It is your right. And voting en masse and in communities, it depends on your demographics. That's why people have to go door to door. Stacey Abrams, I mean, her campaign has been
boots on the ground.
Yeah, she has been a boots on the ground. This is the way you reach Black people. And this demographic, this is what they need. They don't need high technology, which is what he said is in this whole barrel of words in terms of what voting means. It's demographics, it's technology. How do you reach the voter? Money, okay, campaign financing. That's what that's about. And so you have to also reach engagement. How do you engage certain people who have reached voter apathy? Do we go to the church? Do we knock on the door? Where do you find the most people? President Obama won because he got engagement up. He got the people interested in him, and I remember walking down to the University of Chicago saying this, what's this man Obama talking about? He's going to be the first Black president. And I walked down there, there might have been 100 people in the audience. And this man won. How? Because he got people to vote. He got the engagement. He understood his demographics. He understood technology. And yes, the money came.
And the other part of that, too, I want to add, just for people who are listening, is if you don't vote, you cannot complain. You can't complain when they take away your ACA or when they cut your Medicaid or your Social Security or anything else that has been helping you to survive because you didn't vote. That's right. And they feel like they can just do, and I'm not saying whether it's Republicans or Democrats or whomever, but if you don't vote, then they feel like, oh, well, we can just do whatever we want to do. Well, versus voting for a candidate that is aligned with your beliefs.
Well, when people don't vote, it comes to the second determinant of health, the political determinant of health, and that is government. We have to be students of how our government works. And I don't know about you, but I remember Texas, since we're both from Texas, taking U.S. government history, and we had to take Texas government.
Texas government as well. Absolutely.
Had to take these classes. And it's a disservice to take those classes away from young people and have a group of young people not really understand the power of the vote, the branches of government, and what each branch is supposed to do. We have to understand that when we're looking at policies and we're looking at laws, the way the government works is that, it's kind of selfish. Is this going to be good for the government? Which Attorney Dawes talks about, there were policies in place because basically we found out that we would not have a recruitable military force if we did not address certain things like mental health, that we did not provide mental health services. And so, we've been able to push some of those issues and legislations about mental health care to the top, and then, we balance that off with commercial interest, and then we go back to gun control and gun violence. We also go to special interest groups. And, with this latest verdict from the Supreme Court, we're not really sure what was at play, but we have to figure it out, because in order to reverse it, in order to move forward, we've got to figure out what the special interests were. Was it more on the government side, or was it more on the commercial side?
And obviously that's Roe versus Wade that you're speaking about.
Yes. Mm-hmm. Yeah. So, as he continues to give, he also in this book continues to give examples of how the Supreme Court has ruled, and some of these rulings have set us back as a nation. Tamara, what I love about what Attorney Dawes does is he doesn't just present the problem, he defines what the political determinants of health is. He also tells us about the important role of advocacy. And he tells us that, at the heart of the health equity movement are health equity proponents who must directly act to address the ramifications of the political determinants of health. They must connect the dots for stakeholders that show how voting, government, and policy impact our ability to lead healthy and quality lives. It is critical. It is crucial not to leave it up to trust, because the government is a human institution where individuals are making the decisions and are responsible for its evolution. Those closer to the policy move the infrastructure forward, which is why people matter. I just love that piece by him. He talks about advocacy as, having these components: due diligence, negotiation, introspection, and then direct action. Love it.
So the first determinant of political health is the vote or the act of voting. Second determinant of health is government, how that works, along with the Supreme Court. And so what is the third part of
the third part determinant of the political determinants of health is policy. What becomes policy? And so you can have an overarching policy that the government says, and then you can have states' policies. Right now, what we're seeing are states saying this will be our policies. And I think the most relatable thing is, as a nation trying to get everybody to put a mask on, public health policy, then became, well, my state doesn't have mask mandates, your state does. So we actually just experienced this whole idea of policy and policy mandates, vaccine, not to get vaccinated, those types of, that's how I think our latest implementation of policy mandates that we've had to struggle with.
And I truly believe that those were probably, what you just mentioned, were some of the most ridiculous things that we wasted time arguing about. People were up in arms because you asked them to wear a mask. Are you kidding me? Mm-hmm. Versus, even if you didn't think that it saved you, then just do it anyway. Mm-hmm. Just so that, if for whatever reason you didn't blow on somebody or somebody sneezed on you, you had a mask on to keep some of that contaminant out of your nose and mouth so that you don't get COVID. I thought it was ridiculous that people went to such lengths to not wear a mask. I'm like, are you kidding me? Really? This is what is bothering you in 2022. Okay. So whatever. Everybody to each his own, I guess.
Well, that's what he says, kind of clearly what happens with policy. Policy will define the vision, and policy outlines the priorities. It was a priority to me and you. We saw that for other people. Again, I traveled during that time. They clearly did not believe that it was a priority. And policy allows for people to build a consensus, and it is designed to inform the public. So what like I said, our most recent example was the mask mandate and vaccines, for some healthcare workers like myself. This is a very clear and necessary policy. So the Political Determinants of Health, it's a great read. I think it's something, it's right now in the wake of this recent decision It is a must read, particularly for students of public health. But for someone, like yourself, Tamara, this is something that you really should begin to study and understand and digest, because there are chapters in there that are speaking directly to people out in the community who have a wide reach, as yourself as a radio host.
All right. Sounds good. So pick it up, The Political Determinants of Health by attorney Daniel Dawes. He is the executive director of the David Satcher Institute and also a leading expert on the conversation about racism in medicine. He has testified before Congress about the lasting effects of racism in healthcare. You might want to pick it up. I'm going to be doing the same thing just because I need to know more. And that's, what you need to do. I'm Tamara G. again with the Dr. Say podcast with our very own Dr. Kendra Outler, who is an anesthesiologist based in the DMV, DC, Maryland, Virginia area. Dr. Outler, before we go, any last words?
I want to tell people, again, use your voice, use your political voice, and study government. And again, reading books, like I said, by people like Daniel Dawes will help you become more informed and not feel powerless. And as you join groups to advocate for your communities, understand what you're fighting for and what you're fighting against.
Thank you so much, Dr. Outler. What the Doctor Say podcast. Until next time, I'm Tamara G. See ya.
What the doctor say?